ਕਾਲ ਜੀ ਕੈਨੇਡਾ ਸਰਕਾਰ ਦੇ ਵੱਲੋਂ ਸੋਮਵਾਰ ਨੂੰ ਕੁਝ ਬਾਰਡਰ ਰਿਸਟ੍ਰਿਕਸ਼ਨਸ ਦੇ ਵਿੱਚ ਢਿੱਲ ਦਿੱਤੀ ਜਾਣ ਦੇ ਬਾਰੇ ਐਲਾਨ ਕੀਤਾ ਜਾਵੇਗਾ ਅਤੇ ਸ਼ੁੱਕਰਵਾਰ ਨੂੰ ਕੈਨੇਡਾ ਸਰਕਾਰ ਦੇ ਵੱਲੋਂ ਇਹ ਐਲਾਨ ਕੀਤਾ ਗਿਆ ਸੀ ਕਿ ਨਾਨ ਐਸੈਂਸ਼ੀਅਲ ਇੰਟਰਨੈਸ਼ਨਲ ਟਰੈਵਲ ਅਤੇ ਕੈਨੇਡਾ US ਬਾਰਡਰ ਰਿਸਟ੍ਰਿਕਸ਼ਨਸ ਨੂੰ ਐਕਸਟੈਂਡ ਕਰ ਦਿੱਤਾ ਗਿਆ ਹੈ ਅਤੇ 21 ਜੁਲਾਈ ਤੱਕ ਮਤਲਬ ਇਹ ਕਿ ਹੁਣ ਨਾਨ ਐਸੈਂਸ਼ੀਅਲ ਟਰੈਵਲਰਸ 'ਤੇ ਪਾਬੰਦੀ ਅਤੇ ਕੈਨੇਡਾ US ਬਾਰਡਰ ਰਿਸਟ੍ਰਿਕਸ਼ਨਸ 21 ਜੁਲਾਈ ਤੱਕ ਜਾਰੀ ਰਹਿਣਗੇ ਅਤੇ ਇਹ ਐਲਾਨ ਦੇ ਨਾਲ ਹੀ ਇਹ ਜਾਣਕਾਰੀ ਵੀ ਸਾਹਮਣੇ ਆਈ ਕਿ ਕੈਨੇਡਾ ਸਰਕਾਰ ਦੇ ਵੱਲੋਂ ਸੋਮਵਾਰ ਨੂੰ ਫੁੱਲੀ ਵੈਕਸੀਨੇਟਡ ਕੈਨੇਡੀਅਨਸ ਪਰਮਾਨੈਂਟ ਰੈਜ਼ੀਡੈਂਟਸ ਅਤੇ ਹੋਰ ਲੋਕ ਜਿਨ੍ਹਾਂ ਨੂੰ ਕੈਨੇਡਾ ਆਉਣ ਦੀ ਇਜਾਜ਼ਤ ਹੈ ਉਹਨਾਂ ਨੂੰ ਕੁਝ ਬਾਰਡਰ ਰਿਸਟ੍ਰਿਕਸ਼ਨ ਤੋਂ ਢਿੱਲ ਦਿੱਤੀ ਜਾਣ ਦੇ ਬਾਰੇ ਐਲਾਨ ਕੀਤਾ ਜਾਵੇਗਾ ਅਤੇ CBC ਨੂੰ ਐਤਵਾਰ ਨੂੰ ਇੰਟਰਵਿਊ ਦੇ ਦੌਰਾਨ ਕੈਨੇਡਾ ਦੇ ਪਬਲਿਕ ਸੇਫਟੀ ਮਿਨਿਸਟਰ ਦੇ ਵੱਲੋਂ ਇਹ ਕਿਹਾ ਗਿਆ ਕਿ ਬਾਰਡਰ ਰਿਸਟ੍ਰਿਕਸ਼ਨਸ ਦੇ ਵਿੱਚ ਚੇਂਜਸ ਕੁਝ ਮੇਜ਼ਰਸ ਦੇ ਲਈ ਲਿਮਿਟਡ ਹੋਣਗੀਆਂ ਮਤਲਬ ਬਲੇਅਰ ਦੇ ਵੱਲੋਂ ਇੰਟਰਵਿਊ ਦੇ ਦੌਰਾਨ ਹੋਰ ਪਾਬੰਦੀਆਂ ਦੇ ਵਿੱਚ ਕਿਸੇ ਤਰ੍ਹਾਂ ਦੀ ਢਿੱਲ ਦਿੱਤੀ ਜਾਵੇਗੀ ਅਤੇ ਇਸ ਦੇ ਬਾਰੇ ਕੁਝ ਜਾਣਕਾਰੀ ਵੀ ਦਿੱਤੀ ਗਈ ਅਤੇ ਕਈ ਸਵਾਲਾਂ ਦੇ ਜਵਾਬ ਵੀ ਦਿੱਤੇ ਗਏ ਅਤੇ ਬਿਲ ਬਲੇਅਰ ਨੇ CBC ਦੇ ਇੰਟਰਵਿਊ ਦੇ ਵਿੱਚ ਹੋਰ ਕੀ ਕਿਹਾ ਤੁਸੀਂ ਵੀ ਦੇਖੋ
Listen, you've extended the non-essential travel ban now for another month. What kind of pressure are you under from the American side to start loosening things up or give them a bit of a clearer timeline on that?
Yeah, I will tell you, we're working really closely, and the communications with the United States government is very, very clear on all of the measures that we are both taking, and the measures we've taken have been largely symmetrical and reciprocal between the two countries. But we're hearing not just from American politicians, but even from our own. I speak regularly to the border service mayors. They're all anxious to get back to some semblance of normalcy. We understand that that there's it's very significant economic and social impacts, particularly on border communities. But Rosie, we're following the advice of the Public Health Agency of Canada. Just to be really clear, what we've said is that we're rolling over to July 21st the prohibition on non-essential travel, and with some exceptions that we put in place. The supply chains are still operating fully. We're still allowing the movement of essential workers. And this week, tomorrow, we'll be announcing new rules for fully vaccinated travelers because, as you've said, we've met certain thresholds, and that's the payoff of meeting those thresholds. We're not there yet. We've hit an important benchmark, but we haven't reached the finish line. And the finish line is when a significant majority of Canadians, approximately 75%, are fully vaccinated. So we're moving towards those targets, and we're making changes, I think, appropriate to the level of vaccination that's currently in place. We're listening to our own communities and to Canadians about this, but we're moving forward cautiously but steadily towards a phased reopening.
Okay, a few things there that I need to dig into. I did talk to the mayor of Sarnia at the top of the previous hour, who is, as you know, as you just said, frustrated, wants a more detailed plan of how this is going to unfold. He would like, as of tomorrow, to hear about whether quarantine time will be shortened. Right now it's 14 days, whether it will be shortened if you're doubly vaccinated. And he would like to hear more about humanitarian cases, so people who are separated from their family. Are those things also on the table for tomorrow, Minister?
Yeah, Rosie, what we'll be talking about tomorrow is some of the changes in that PHAC has in place, and I'll leave it to PHAC to announce that tomorrow. But changes with respect to the government-assisted hotels, perhaps some implication on who would be subject to quarantine. What it means to be a fully vaccinated traveler, and what changes can now be accomplished for those people who are in fact fully vaccinated. We also know that cohort of fully vaccinated Canadians is right now at approximately 20%. We're moving with the big lift of vaccine delivery that's taking place over the next 4 or 5 weeks. We're very optimistic and encouraged by the pace at which we're able to get those vaccines to the provinces, the rate of their administration. I think we're rapidly reaching the goals that we set for ourselves. We're just not there yet.
Okay, so we'll hear more about quarantine hotels tomorrow. We'll hear more about what happens for doubly vaxxed Canadians. What about doubly vaxxed anybody else, Americans or someone else that wants to travel from another country? Are we at that place where we're willing to accept those people yet?
Well, our first priority is taking care of our own citizens, but we are, of course, giving full consideration what it means for any traveler to be fully vaccinated and the implications it would have at our borders and for people who would otherwise be allowed to travel. But to be really clear, right now, Rosie, we are discouraging all non-essential travel. We still have work to do and a ways to go. And it's not just vaccination rates, by the way. Let me be clear about that. I know the Public Health Agency of Canada is keeping a very close eye on the variants of concern. We've talked to the provinces and territories, and although for very good economic and social reasons, they want to move towards normalcy at the border, they're still very concerned, as are we, on the potential impact of variants. And so I think it's necessary and prudent to, move forward with what we can move forward with, but also to be very careful in that reopening to make sure that we don't expose Canadians to undue risk.
We know the quarantine hotels are going to end. The Prime Minister and you have said as much. It's just in terms of timing. What will that change, do you think, in terms of how the ease at which people can travel? Will it make it easier? Will people be more inclined to travel if they don't have to stop at those hotels?
Yeah, Rosie, where I'm absolutely certain it's going to impact on traveler volumes, and that's another thing that we've been working really hard to be ready for. Both the Public Health Agency of Canada and my border service officers are making sure that we have the capacity to properly facilitate what we believe will be. There's a lot of pent up demand for travel. I know a lot of Canadians want to get down to their. Some of them have residence in the United States.
Yeah.
The need to connect with family and friends. You mentioned it at the outset. Some of these compassionate cases. We've been addressing that over the past 18 months with bringing in new exemptions for those who families that are separated and where, there are real, heartbreaking cases where people really need to come together for funerals or other important family events. We've been doing our very best to accommodate that. We're going to continue to do that. I get it. There's all Canadians. I myself am anxious to return to a state of normalcy at the border. We're working really hard to make sure that we're ready.
The Prime Minister and the Minister of Transport have talked about a two-track plan for vaccine certification, and you yourself have mentioned the Arrive Canada app, which will be the beginning of that, to upload proof of vaccination. How much longer then will we have to wait for the second step, where we will be using, I guess, some sort of app for international travel, for instance? The EU is already doing that kind of thing. How close are we to that?
Yeah, we're working with our global partners, particularly with the United States, in the development of a vaccine certification system that will be very efficient and be able to gain access and utilize appropriately and with appropriate personal privacy concerns accommodated within it, but to be able to certify that an individual traveling is in fact fully vaccinated. But in the interim, Rosie, I think we've got a very good interim measure in place using the ArriveCAN app. We've been using the ArriveCAN to manage traveler information and health information for arriving travelers now for several months. We've made changes to that app in order to be able to use it to certify that travelers are in fact, they can present their documentation, it can be proven. I will tell you, on an interim basis, our border service officers are going to check 100% of the time to make sure the document lines up and is in fact verified on that which is placed on the app. But we believe this app is going to help us accommodate those inevitable increase in traveler volumes.
Sure.
A lot more people are going to be traveling. Dealing with that information in a digital format is going to be really helpful.
Is the app going to be a continental approach? Are you trying to come up with something with the Americans that would be a similar app or a shared app?
Yeah, no, the app, to be clear, is the ArriveCAN app. It's for travelers coming
the second
into
part,
Canada.
though. The second part of that.
Oh no, the second part, I think there is important work that is taking place to ensure that not just with the Americans, but with the European Union, et cetera, the places where Canadians travel, so that there is a system of vaccine certification for travelers from all of those locations. When we reach that point where the Public Health Agency of Canada advice is to allow fully vaccinated travelers from other parts of the country, and I'll leave that to them to determine when that is implemented, but we want to make sure that we're ready to be able to verify that that people have been vaccinated. I will tell you, the ArriveCAN app is going to be able to provide verification of vaccines taken in the vast majority of places in the world, but of course there are a number of vaccines that have not yet been approved by Health Canada, and for that reason there's some decisions that we made. Rosie, it's an important opportunity to sort of point out that all of the steps that we are taking at our border are informed at all times by the Public Health Agency of Canada's advice. They're the people responsible for the health and safety of Canadians, and our border service officers are working hard to make sure that we can follow and uphold, the advice that they want us to put in place. They're responsible for the Quarantine Act and for the measures that we put in place, but through the Order in Council. And I think they've taken a very careful and prudent approach. But we realize the impact of full vaccination is going to make some changes at the border, and we're working hard to be ready.
Last point on this, Minister, just because of the huge amount of vaccine that's arriving before the end of July, 68 million doses will be up to. Do you anticipate that the border could be open by the next time this order comes up, which would be August 21st? Would that be, do you think you're going to have to extend it further, or would you anticipate that things will loosen by then?
Well, and again, I don't want to get ahead of the advice we'll receive from PHAC, but clearly, as those vaccines arrived and as Canadians, continue to get in those lines and get vaccines into their arms, we're really optimistic that we can meet that threshold of 75% of Canada's population vaccinated. When we reach that threshold, changes are possible. So I think the combination of vaccinations is a very important consideration. And Rosie, I would just make sure that it'd be very clear. We're also keeping a really close eye on the variants of concern,
for sure,
and making sure that our capacity is able to handle, it's not just capacity of processing travelers, but also, the testing regimes that we'll put in place to continue to protect Canadians.
Got to leave it there. Minister Blair, thank you so much.